This chapter is 14 and it's called Some Miscellaneous Cases. It's quite a long chapter, but maybe an important one because it lists a number of different conditions that had been treated by John Armstrong. They include bedwetting, menstrual trouble, nephritis, mucus colitis, eye injury, psoriasis, rheumatic fever followed by influenza, pyorrhea, obesity, prostate troubles, case of prostate trouble in its incipient stage, bronchial asthma, gangrene, rash on the arms, a large wart on face, lump on arm, a mysterious case, one is called. That's quite interesting. Jaundice, case of paralysis, premature old age, loss of memory, etc. Loss of hair. And then there's a smaller section at the end of this same chapter giving reports from correspondents on influenza, pneumonia, pleurisy, and appendicitis. So, because it's a longish chapter, I'll see how far I can get into it in, it may not be one recording. So, chapter 14. Enuresis nocturna, or bedwetting. Sometimes this is merely a bad habit, but more generally it is a morbid symptom in nervous and anemic children. Weakness is the principal cause, although it may also be due to worms. Children are supposed to grow out of this distressing condition, but this is not always the case. A boy, aged 9, had suffered from enuresis all his young life and had been treated by physicians both of the orthodox and unorthodox schools. Was very thin and very unhappy about his affliction. Fasted on urine for 11 days. Result, complete cure. Menstruational trouble. The patient had suffered for over 2 years from too prolonged and too frequent menstruation, for which she had first tried allopathy without effect, and then herbalism, from which she only obtained partial relief. The complaint was not only weakening her physically, but was also affecting her mental equilibrium. During one of her long periods, which had already lasted a fortnight, she decided to try urine therapy. Although at first the urine was heavily overcharged with menstrual blood, she was nevertheless heroic enough to take it. During her fast, she also sipped from 2 or 3 pints daily of plain cold water. In 3 days, the urine became normal. She continued the fast for exactly 28 days, during which she was rubbed with a healthy person's urine for some hours each day. The case was a complete cure, not only of the menstrual trouble, but also of long-standing nasal catarrh and an increasing tendency to deafness. Nephritis, with other distressing symptoms. Young woman. Had been in the care of 2 doctors for some weeks, and had also seen a specialist who told her mother that the case was a hopeless one, and that in all probability this particular victim would not live to see the approaching Christmas. The young woman was then brought to me, to encourage her and induce her to take the offensive-looking urine she passed. I even went so far as to drink a little of it myself. After a fast of 30 days on urine and cold water only, and daily rubbings with healthy urine, the patient was cured of her grievous complaint, nor did any other malady develop subsequently. When I first saw her, she had weighed 106 pounds. 4 months later, on a regime of 2 well-balanced meals a day and the continued use internally and externally of her own urine, she weighed 136 pounds nude, which is the normal weight for a woman of her height and build. Mucus colitis, boy of 6, began to discharge mucus frequently, though otherwise there were no apparent symptoms of ill health. The doctor, when sent for, said the trouble was prevalent and prescribed castor oil. But the boy's father, who knew me and my methods, thinking a castor oil purge too violent, sent for me as soon as the doctor had gone. I put the boy on a urine fast, and in 48 hours all the trouble had disappeared. Nevertheless, as it is foolish to start eating as soon as symptoms vanish, the boy fasted 4 days in all. 2 days later, the boy's mother developed the same colitis symptoms, likewise did her sister. I fasted them both for 8 days according to my method, though the actual symptoms vanished in 5 days or sooner. It is worthy of note that all 3 patients were strict vegetarians, and that the boy had never tasted flesh in his young life. I advised them to include some flesh food in their dietary. Eye injury. In 1920, a lady came to me with a splinter of chipwood in one eye. The splinter had pierced the iris and was sticking out an inch or more. I removed the splinter, fasted the patient on urine and water for a few weeks, at the end of which time the trouble was completely cured and the patient had perfect sight. Psoriasis, gentleman aged 60, fasted on urine and water for 1 week in June 1920, and again for 1 week in September of the same year. During and between the fasts, had rubbings of his own urine in spells of an hour 3 times a day. Complete cure. He continued the intake of urine as a daily habit, and 10 years later, though 60 years and 10, only looked about 56. I regard psoriasis and eczema as amongst the easiest diseases to cure by means of urine therapy. That is provided they are taken in time. Nor is lupus, a more serious skin disease, and said to be caused by the tubercle bacillus, by any means incurable, though the treatment takes longer. Rheumatic fever followed by influenza. Female patient, 16 stone, though not a big eater, having lost 2 stone before I visited her. Heavily constipated, suffering from insomnia and worry. Bedfast with swollen hips, feet, ankles, and abdomen. Fasted a week on urine and plain water. Was well rubbed every day according to my usual method. Complete cure in a month and back at her occupation. Pyorrhea. Patient was in the habit of visiting his dentist every 6 months. Dentist informed him that he was suffering from pyorrhea. Having heard of urine therapy, without telling his dentist, he took half a pint of his urine every morning, and also urine as a mouthwash. In 9 weeks his trouble had completely disappeared, much to the surprise of his dentist, who wished to know what had caused such a marked improvement in his general health as to cure pyorrhea. The cure was effected even without a fast. Case reported by a friend. The notion that pyorrhea is a local disease for which one must have all the teeth extracted is a fallacy. There is no such thing as a local disease. There are only localized symptoms. Cleanse the body of its impurities by a fast on urine and plain water, and pyorrhea vanishes automatically. I have observed this in numerous cases, in fact in all cases I have ever treated. As for myself, I never require to visit a dentist. A well-balanced diet and urine therapy have preserved my teeth. Obesity. Married lady, age 30, weighed 12 stone, lived on the usual 6 pounds. I'm not sure what that's meant to say. Had no children, balanced diet, but was not a glutton, masticated her food, and drank only water after or between meals. Previously, she had tried various diets without effect, and had tried fasting on plain water only, but with the result that as soon as she resumed eating, she put on weight even more rapidly than prior to the fast. Finally, she consulted me. I advised a urine plus plain water fast with daily rubbings, and at the end of 14 days her weight dropped to 10 stone. I then revised her diet, put her on a well-balanced regime, and suggested 2 meals a day only. By dint of living in this way and taking her own urine daily, her weight has remained at about 10 stone, and although she is now past 50, she looks about 33. With many people, obesity does not arise from overindulgence at the table, but from badly functioning glands caused by toxins and a deficiency of the required elements which should be derived from non-processed foods. The fast cleanses the blood tissues, and the intake of urine brings back normality to the disordered glands. I have conclusively proved this by a large number of cases of obesity I have treated, or where obesity has been present among other symptoms. Prostate troubles. Enlargement of the prostate is a term referring to an affliction often to be met with in elderly men. The most prominent symptom is an irritability of the bladder and a progressive incapacity to empty it. The prostate gland undergoes a considerable increase in size, and by pressing on the neck of the bladder forms an obstruction to the outflow of urine from that organ. See E. H. Ruddock, M.D., Vada Mecum. Case of prostate trouble in its incipient stage. Old gentleman began to have difficulty in voiding his urine. Was advised by a friend to try taking half a pint of his own water every morning on rising, this to be followed at the usual time by a light breakfast instead of the customary full meal. Result: in 1 month after starting the treatment, he was rid of his trouble. Bronchial asthma. Miss C. Doctor had diagnosed the case as bronchial catarrh, the victim said to be in the early stages of TB. General health very poor, breathing difficult. Victim had to resort to palliatives to obtain ease and short periods of much-needed sleep. Felt very weak and debilitated. Heard of urine therapy. Fasted for a fortnight on urine, but without the rubbings. In 3 days, the improvement was so marked that she was able to breathe freely and sleep each night for several hours on end. Broke fast, took 2 meals a day only, and continued the intake of urine. But the fast had not been sufficiently long to eradicate the trouble, and her symptoms returned. She then wrote to me for advice. I told her she had not broken the fast correctly, advised further fasts to be attended with the rubbings, and gave her a diet to be followed between the fasts. The final result was a complete cure, and the patient has remained in excellent health. She continues to take her own urine daily, and from time to time resorts to short fasts, with the result that she feels better than she has ever done. Case of gangrene and after effects of drug treatment for thyroid trouble. Reported by the naturopath Mr. O. Warnock Fielden, lady aged 40, long history of drug treatment since she was 15. In early life she had injections during a number of years for overactive thyroid and also for colds. More recently, she had had an operation with a view to improving the circulation, seeing that when the weather was cold and even at other times her hands would go blue. No improvement was noticed after the operation. Before I was called in, the local doctor had retired from the case, pronouncing it to be hopeless. I found her hands a mass of pus, moist gangrene, and almost skinless. The necessity for amputation of both hands had been mooted and feared. After making a start with less severe measures such as hot fomentations, cold compresses, urine packs, urine drinking in small quantities, and an antiseptic ointment to relieve the intense drawing pains, I finally advocated a complete fast on urine and plain water only, at the same time continuing the packs. The fast lasted 3 weeks, but even after a fortnight the patient could use her hands and could knit. Granted that the urine drinking and the urine dressings were of much value to the treatment, I nonetheless consider that the 3 weeks fast was the decisive factor in this case, since it enabled the drug-laden system to be drained of its impurities. Rash of the arms. Mrs. C. suffered for over 3 years from an irritating eruption on her arms, had tried various ointments and lotions without any relief, was finally induced to try the effect of urine, which she dabbed on every night. The rash disappeared completely within a few weeks. In this case, no fasting was resorted to or any other measures. Large wart on face. Mrs. C. reports that she employed the same treatment for an unsightly excrescence on her face, which in a short time shriveled up and then fell away, leaving no scar. All 3 of these cases were supplied by Mr. Warnock Fielden. Lump on arm. A correspondent reports the case of a lady who developed a nasty blue-looking lump about J-inch high. So that was a number that's not come through. We don't know how high. Which she feared might become malignant. She was advised by an acquaintance to treat it with urine compresses, and in less than 3 weeks it fell off, leaving the skin healthy and clean. A mysterious case. Male patient about 58, had been in the hospital for several weeks for observation and treatment, but at the end of the term was said to be incurable and was sent home to die, but enjoined to keep in touch with his local doctor. He was given a particular drug to take with him, which was calculated to dissolve any food he ate. When at the request of a gentleman I was treating, I first saw the patient, I reckoned he was dying sure enough, but not from the disease so much as from the powerful drug poison he was being given. I noticed that his eyeballs were much distended, and that he was thin, but not to the extent of emaciation. He told me he had been a careful eater, a hard outdoor worker, had kept regular hours, had never been subject to colds, and had never been bilious or constipated, and had never had diarrhea. His only vice had been the use of snuff, but he had discontinued the habit a year previously. I only stayed with him a few minutes at my first visit, told him to fast and to drink nothing but cold water and every drop of urine that he passed both day and night. I also told him and his wife not to be surprised at any symptoms which might occur in the process of elimination. His stools and ejecta were to be kept for my inspection. 3 days later I called again to be shown 2 large buckets full of the foul matter he had vomited, the vomiting having started 24 hours after he had taken his first draught of urine. There had also been great looseness in the bowels and much catarrhal discharge from the nose. In fact, he had been obliged to use a dozen handkerchiefs, which were not only soiled with ropy mucus, but also with snuff. The fast was continued, and in a week all discharge ceased. The penance was broken in 10 days, and the patient was cured. At the time of writing, he is over 70. This case is interesting, as it serves to show that with urine therapy it is quite unnecessary to know the name of the disease in order to treat it. It is further interesting as showing that a foreign substance, snuff in this case, may be lodged in the tissues for months after the taking of it has been discontinued, only to be eliminated during a body cleansing fast. Which reminds me that the eminent German naturopath Louis Kuhne relates of a case where during the eliminative treatment the sweat of the patient had smelt of drugs the allopaths had previously used to cure, or rather suppress, the disease. See his New Science of Healing. Jaundice. It must be remembered that jaundice is merely a symptom of some chronic or acute affection of the liver and is not a disease in itself. My first and most difficult case where a jaundice condition obtained was in 1919, at the beginning of my career as a urine therapist. This case took 10 days to clear upon a urine fast plus tap water. I have not had a number of jaundice cases, but with those I have treated it has been remarkable to watch the discoloration of the skin gradually disappear during the first 2 or 3 days of the fast, and then, as the penance has continued, give place to a colour as fresh and healthy as the complexion of a dairymaid. 10 days or less have usually sufficed to clear up a jaundiced condition, that is provided it has not been due to cancer of the liver. This dread disease I regard as practically hopeless by whatever means it is treated. Even biochemic practitioners who have claimed to cure some cases of cancer maintain that if the liver is involved, nothing can be done. Nevertheless, I once supervised a urine fast in the case of a man who had been such a heavy drinker that over a period of years he had drunk a whole bottle of spirits per diem. This man decided to try a urine fast while his doctor was away on holiday. He drank all the urine he voided, but on the 10th day it remained as bloody and as full of red sandy deposit as it was at the beginning of the penance. On the day in question the doctor returned from his holiday, and an incision was made in the scrotum. The following day the patient passed away in a state of unconsciousness. Whether his liver, which was dead, could have ever been made to function again if the fast had continued and there had been no surgical interference is very problematical, but I confess I was much distressed that at any rate I was not given the chance to try and save the unfortunate man's life, especially as during the fast he had lost very little flesh except in the face, and so here seemed some prospect of his ultimate recovery. And after all, where there is life, there is hope. Case of paralysis, premature old age, loss of memory, etc. Male patient aged 60. Medical verdict, a few weeks to live. Had had 2 paralytic seizures, and the first occurring after an attempt to get rid of influenza by means of fresh fruit and fruit juices. After the second seizure he had no memory, and appeared to be in his dotage, though only 60. He underwent a urine fast with rubbings for 59 days, broke the spell for a fortnight, living on the 1 meal a day plan, then fasted further for another 35 days. Memory and his speech returned in 20 days during the first fast, and the cure was completed during the second, the prime cause of the trouble having been an arthritic condition. Loss of hair. The same man who had lost his hair not only regained it during his second fast, his head was rubbed daily, but instead of being grey, it assumed its original colour. Many of my correspondents, I may add, report renewal of hair as the result of rubbing the head with old urine as a daily habit. Reports from correspondents on influenza, pneumonia, pleurisy, and appendicitis. These reports show that, as a general rule, from 3 to 8 days urine fast suffices to cure influenza, pneumonia, and pleurisy. The same can be said of appendicitis. In some cases of the latter, 1 small meal a day has been allowed, though all the urine passed must be taken. In severe acute cases with fever, a complete urine fast is essential. And here I would emphasize the fact that to press food on a sick man or woman on the principle that strength must be kept up is the height of medical folly. To an invalid whose instincts and organs rebel against taking nourishment, food acts like a poison. Cataract. Before it became illegal for laymen to mention the fact that cataract may yield to treatment without operation, I found that in many cases 10 days urine fast was sufficient to dissolve the film that forms over the eye. The longest required was a 28 days fast. Whether it is against the now existing law for any layman to say that he had cured cataract before the law was passed is a subtle point on which I am not qualified to pronounce. But in case the disclosure should be illegal, we must assume that the cases cured had been falsely diagnosed, since the law implies that no one save a qualified oculist can cure genuine cases, namely with a knife. Nevertheless, it is only veracious to say that cataract is by no means always an isolated condition. What we need to remember is that the eye is part of the body, and therefore in treating the body as a whole for other symptoms, the local condition is apt to cure itself without any direct attention. Glaucoma. This, according to orthodox medicine and even to naturopathy, is a very serious condition. Oculists perform an operation, but in many cases the patient sooner or later merely goes blind. In any event, mutilation can never be termed a cure. Patients who have not been tampered with I have known to respond well on urine fast of about a month's duration. As against that cases which have been surgically interfered with, as a general rule must be considered practically hopeless. Rheumatism. In this country, England, the weather is often blamed for rheumatic conditions by persons with insufficiently alkaline blood. But where the blood and body free from acidity and foreign matter, the weather or changes of weather would have no effect. With regard to the cure for rheumatism, of which some doctors say there are 26 different kinds, I have found that patients always respond well to a urine fast of from 10 to 12 days, or even less in simple cases. The fast must be attended with urine rubbings and urine packs. After the cure, revision of diet to a well-balanced regime is essential to avoid recurrence. Many cases have even responded to the 1 meal a day plan. The food must be carefully chosen, alcohol and condiments avoided. plus the taking of autogenous urine, the urine rubbings and urine packs. Such cases, if of not too long standing and severe, have usually cleared up within a few weeks. Arthritis. This painful and distressing condition is about as far removed from rheumatism as a severe attack of influenza from a slight cold, and is one of the very worst conditions to tackle, notably because the foreign deposits are largely lodged in the bones. Even to cure an incipient case, I have found that it takes anywhere from 12 to 40 days on a very carefully selected diet, the taking of every drop of urine passed, and long daily rubbings with urine. These were cases where the patients had objected to or had not found it feasible to fast. Nevertheless, I regard such treatment as only half measures, and maintain that a complete urine fast of even 10 days does far more to help the victims than months of mere dieting and the taking of urine. But I must emphasize that where the trouble has become deep-seated and the victim is practically crippled, there is little prospect of obtaining a cure. I will now add a few cases kindly supplied by the naturopath Mr. Oliver Warnock Fielden. Bronchial asthma. Mr. D.E., aged 37, discharged from the Navy for bronchial asthma, from which he had suffered since the age of 14. The sea life seemed to make the trouble worse, disturbed each night at least 4 times in order to use a medical spray. Also, he dare not go to the theatre without it so that he could use it in between the acts. Within 3 months, during which he drank urine up to 3 or 4 pints a day and 2 short fasts of 36 to 40 hours each on urine alone, he became so much relieved that he never thinks of taking his spray to the theatre, nor does he wake up at night to use it. All fear of his trouble has left him, and his general health is vastly improved. Another case of the same trouble improved in a 4 days fast on urine, when a 3 weeks fast at a well-known nature cure home had utterly failed. After every drink of urine, a wad of mucus was discharged. The last day of the fast produced such a clot of mucus that the patient went out and tested his breathing by walking up a hill. Experiencing no difficulty, he immediately returned to work. Diseased kidney. Mr. G.D. In May 1944, he was in hospital for the removal of his right kidney. He had suffered great pain, the urine was the color of blood, and the X-ray had shown a large stone lodged in the pelvis of the kidney. The surgeon's opinion was that the kidney was diseased, and not to remove it would be a danger to life. However, Mr. D. refused the operation and came to me. He took to urine drinking, quite naturally, drank all he passed, fasted repeatedly for several days at a time, and within a few weeks the condition was improved to the extent that there was no pain and the urine was of normal color. In 3 months, Mr. D. returned to the hospital and was told that there was nothing wrong with his kidney. As a result of this successful treatment, Mr. D. brought me a patient who had been in hospital waiting to undergo the same operation. He was also cured by the same method. In such cases as these, one must accept the verdict of the examining surgeons and the radiologists, who in both instances were pressing for an operation as the only means of relief, or even of saving life. When later on they maintain that there is nothing at all wrong, and the X-ray gives a clear proof of a healthy kidney, one is forced to assume that the fasting and the urine drinking has affected the cure. To conclude this chapter, I may append 1 or 2 suggestions made by my friend Mr. O. Warnock Fielden as to how urine cures, although I may not altogether share his views. He writes, quote, "There may be some healing force in the return of the unexpected hormones, particularly the sex hormones, which find their way into the urine. There are cases known in which urine is taken internally for the sake of these substances alone. There may also be a case made for the return of the tissue substance which is in solution in the urine. Organic tissue may be leached from the vital organs by means of the poisonous substances lodged there from the food and drink taken into the body, and also from the drugs and injections of medical science. It is claimed by some that these substances may be returned and used again in rebuilding healthy organs. This is difficult to prove, but there are many cases on record in which diseased organs have been renewed by means of drinking large quantities of urine. More than this, it is impossible to say. The explanation which appeals to me more than any other is that cures are obtained by means of the homeopathic principle. There is no doubt that although it is claimed that toxic matter in quantity is not thrown out of the body in the urine, otherwise we would not become ill because it remains in, there must certainly be found in all urine a homeopathic or infinitesimal dose of the particular toxic complex of the individual concerned. That must surely be beyond all argument. If this infinitesimal dose is returned to the body, an antibody, according to the homeopathic principles, will be produced, and will therefore tend towards a cure of the condition. This is all still the quote. In the natural habits of animals, we observe the fact that they continually lick themselves. In this way, they undoubtedly take into their systems homeopathic doses of their toxic condition. After every meal, even, this dose would tend to correct any harm likely to occur from eating food which would not agree with them, perhaps even poison them. May not this habit be nature's immunization scheme par excellence? Medical science has formulated a system of dangerous inoculations to do exactly the same thing as the dog does when it licks itself. Nature gives instinct to the dog for its salvation and brains to man for his ultimate destruction. We may be too clever. If anyone doubts the animal instincts to drink its own urine, let him try the experiment of handing a cup to a monkey. The monkey has only one use for it. The goat is considered to be the most healthy of all animals, so much so that its milk is much sought after for TB cases. May not this be explained by the fact that the goat can, and very often does, drink its urine straight from its body? When man first appeared upon the earth, some provision must have been made for his security against extinction. Food, clothing, shelter were all stored within the earth, man having only to work for them to satisfy all his material needs. Would the vital importance of his freedom from disease be neglected? If what is stated in these pages is correct, the means whereby health may be attained is always close at hand, easy to carry out, marvelous in its simplicity, and free to everyone. The late Dr. Charles H. Duncan, one of the most enlightened doctors of America, states in his book Autotherapy, "There are in the pathogenic exudates toxic substances to which the patient must develop resistance in order that a cure may be instituted." In other words, in autotherapy, the patient has the right toxic substances within his body, and it remains for the physician to find them and determine the proper dose and the interval between doses, so that the local tissues may develop resistance to them. There is therefore much in some branches of medical research which agrees with the courageous contribution of John Armstrong, which is testified to in the cases mentioned in this book. End of chapter.